These are the topics that we're going to be covering today. I tried to organize them under like what exactly is the cause of the problem. So the circulatory system comprises the heart itself, the blood vessels like the veins and the arteries. There's the blood itself, and then there's the lymph nodes. The lymph nodes are kind of like blood vessels, but they carry lymph instead of blood. So there's different disorders throughout the book, and they're kind of organized similarly in the book, but not all of them are. So I try to put them in the PowerPoint based off like what's the problem. Is it a heart problem? Is it a vascular problem? And so forth. Just quickly going over some of the anatomy. There's a picture here of the heart. So the heart has 4 chambers. You can see, let's see. I don't know if you can see that. This is the top 2 chambers are called the atria, and the bottom 2 chambers are called the ventricles. Then you've got the aorta that comes out of the heart and pumps all the blood to the rest of the body. Let's see what else. It's not shown in this picture, but there's something called the SA node and the AV node. Basically, it's just a clump of cells within the heart. It doesn't really matter where it is. Just knowing that its function is to send out electrical impulses to regulate the heart rhythm. So your heart rate is based upon the electrical impulses of the SA node and the AV node. They regulate how fast your heart beats. Let's see. Then we've got the pulmonary artery, which is this blue one here. You'll notice that blood comes from this atria, pumps into this ventricle, then it goes up into the pulmonary artery, and the blood actually from here goes to the lungs, where it gets oxygen. So we breathe in oxygen, the blood that goes into the lungs picks up the oxygen. Once it's got the oxygen back into the bloodstream, it comes back into this atria, comes back into the ventricle, and then it goes to the body through the aorta to give the oxygen to the rest of the body and all the cells. All right, so our first one is coronary artery disease, and this is a vascular or vessel issue. This should be somewhat familiar when we talk about vascular dementia in psych, where the arteries are clogged, right? So coronary artery disease, the arteries are narrowing and hardening, which is limiting the blood supply to the rest of the body and to the heart. So some of the symptoms, initially you won't notice any symptoms at all, so it's kind of a insidious disease where it kind of springs up on you. Later on, as the disease gets worse, you'll have like crushing chest pain because of the lack of oxygen getting to the heart. You've probably seen people who clutch their arm when they're having a heart attack. That's one of the symptoms as well, like they have that arm pain. They may feel nauseous, vomiting sort of thing. What's the cause of coronary artery disease? There's 2 key words here, atherosclerosis and arteriosclerosis. They sound similar, but they have different meanings. Atherosclerosis has to do with building up of plaque. So this is like your cholesterol, the yellow fat lining the inside of the arteries, and arteriosclerosis, which is referring to the vessels hardening and getting narrower. So people who don't exercise very often, their blood vessels aren't accustomed to having to like stretch, because when your blood pumps faster when you're exercising, your vessels stretch, and so if they're not used to that, they'll just get used to being hardened and won't be able to dilate as much in order to bring blood to where it needs to go. Also risk factors, people who smoke, people who have obesity, hypertension, sedentary lifestyle is just what I was saying, lack of exercise, sitting around, maybe sitting on the couch a lot, and high stress. All of these are risk factors for coronary artery disease. How do we diagnose this? Well, you can do an EKG. You may say EKG or ECG in the book. EKG and ECG are the same. They both mean echocardiogram. The treadmill test. This is where they put a bunch of wires and electrodes up onto you when you go on the treadmill, and they measure your blood pressure, they measure your heart rate to kind of see how you're tolerating it, how your heart responds to doing exercise. Treatment for this, there's multiple different med types, but the most important thing is to know is that you need some vasodilators. Vasodilators, what that happens is like your vessels are hard and narrow like this, squeezed together close. So vasodilators will help the vessels to dilate. Remember from eye and ear, we talked about dilation of the eye and constriction of the eye, so the pupil gets smaller or bigger. Same kind of idea with the blood vessels. The constriction needs to get smaller and dilation needs to get bigger. An angioplasty let's see if I have a picture of that here. Yeah, I do. Another surgery is angioplasty or CABG, which we like to call cabbage just for short. Basically what that looks like, I'll show you here in a second. This is what atherosclerosis looks like. This is the plaque building up. You can see how it's narrowing the passage that blood can get through. So less blood is able to get where it needs to go. This is a cabbage. Basically you can see in the vessel here in the middle, it's almost completely blocked off with fat and plaque, so blood isn't able to get through. So what they do is they take another vein from a different part of your body and they just bypass it. So like they take a bridge with the vein so it can bypass the part that's blocked. So you can see here, like this is where the blocked spot is. So they just take a vein and bypass the blockage, kind of like a detour to get around the blockage there. And that's called a coronary arterial bypass graft. All right, and then we have angina. Angina is kind of similar to when we talked about stroke. Remember we had CVA and TIA. TIA was kind of a temporary transient stroke where it was like the brain cells hadn't completely died yet, but it was like a warning sign for stroke. Angina is basically the same thing for a heart attack. So it's transient chest pain from lack of oxygen and blood flow to the heart, but no lasting permanent damage. Okay, so it's kind of the same idea, kind of a warning sign. So we'll have chest pain due to ischemia. What's ischemia? That's one of our terms. You know what ischemia means? A heart attack can come from ischemia. Ischemia is just basically a lack of oxygen to the tissues. Okay, so this is going to be an important word. It showed up with stroke from last topic, and it will continue to show up. So make sure you know what that means. So this usually happens either in the middle of or right after exertion. So someone's exercising and maybe they're not in shape to be doing whatever it is they're doing, and so they start having chest pain because their heart's having to work harder, but they're not in shape for it. Maybe don't have enough blood flow, so they start feeling chest pain, out of breath, lightheaded, all those things. What's causing this, the etiology, again, usually angina is a result of what we just talked about, coronary artery disease, atherosclerosis, narrowing of the arteries, basically just any reason that the blood flow is compromised to the heart tissue. And that's what myocardium is. Myocardium is the heart tissue itself. That's the medical term for the cells of the heart. Diagnosis, also EKG, and treatment really is stop the strenuous activity as soon as you start noticing the chest pain so your heart can relax and not get stressed out, and also nitroglycerin. Anybody ever heard of nitroglycerin before? Nitro. Anybody know what it does? Yep, it's a vasodilator. So it helps to open up those vessels real wide to allow more blood to get through, right? So like if they're mostly closed because of all the fat and the hardening, these will force the vessels to open up bigger so blood can get where it needs to go. That's what vasodilators are, and nitroglycerin is a type of vasodilator. Here's a picture of what vasoconstriction and vasodilation looks like. So normal on the far left, vasoconstriction is when it's squeezed tight, vasodilation is when it's bigger, just like the pupil with constriction and dilation. All right, myocardial infarction. This is a heart attack. This is the medical term for a heart attack. And this is similar to like CVA. This is referring to the death of the heart tissue due to ischemia, which is the lack of oxygen. Okay, so a CVA is death of brain tissue due to ischemia as well, the lack of oxygen. Okay, so symptoms, occlusion of that coronary artery. So typically the main artery that gets clogged is the coronary artery, which is the main one for the heart. Results in ischemia of a portion of the myocardium, so part of the heart is not receiving the oxygen that it needs, which causes very severe and sudden chest pain. Causes of this, insufficient oxygen supply. Okay, so it could be from plaque, like cholesterol, fat, that's atherosclerosis. Could be from the narrowing, which is arteriosclerosis, or it could be a blood clot. All right, we talked a little bit about AFib slightly last unit when we were talking about vascular dementia. But clots are really common with atrial fibrillation, which is a type of arrhythmia, which we'll talk about here in a little bit. How do we diagnose a heart attack? Well, you go to the ER, usually. There are going to be lab tests They're going to be drawing your blood and seeing what enzymes pop up. Okay, so they're called cardiac enzymes. Cardiac enzymes are enzymes that the heart releases when it's in distress, very similar to the enzymes that the liver released when it was in distress. Do you remember that? What were the liver enzymes? Yep, AST and ALT. So various organs will release specific enzymes when they're in distress, and that's how we know that something's wrong. Okay, so AST and ALT for the liver. For the heart, the main one is troponin. Okay, troponin will be released, and that's kind of like the heart waving a flag, like, help me, I'm in distress. Okay, there will also be EKG changes if there is ischemia as well. How do we treat a heart attack? Well, the main issue is the lack of oxygen, right? So we're going to give these people oxygen, give them, face mask or nasal cannula or whatever to give them some more oxygen. They're going to be extreme pain for that heart pain, for that chest pain. So we give morphine to help treat that, to help make them more comfortable. And then vasodilators. Vasodilators are going to be the main drug group in this unit, just like corticosteroids were the main one for autoimmune. Okay. Thrombolytic drugs. We talk about these with stroke. Okay, because stroke can be caused by a clot, just like heart attack can be caused by a clot. So if there's a clot, thrombolytic drugs, the name of it is TPA. It's short for something, but it doesn't matter. No one ever calls it anything but TPA. I think it's like thromboplasminogen something antiplace, but you don't need to know that. Just TPA is fine. Surgery option, again, CABG, which was that bypass around the clot. An angioplasty with a stent, which I think I have a picture of. So here's an example of an angioplasty with a stent. So they can insert a wire that makes it kind of forcibly opens that vessel to push that plaque out of the way. This is what an EKG will look like. Normal on EKG on the left. When someone's having a heart attack, you can see how the last waveform is like elevated off the bottom. This is what we call ST elevation, this is a hallmark sign that someone's having a heart attack. So this is the EKG changes that the book is talking about. I thought it would be helpful for you to see a visual of what that would look like. Okay, and pause here. Are there any questions about those things that we've talked about so far? Did I lose anybody anywhere? So far, so good. All right, I'm going to talk about hypertension. Don't worry about the word essential. It just means that it's not caused by something else. Okay, sometimes some people can have hypertension as a result of certain drugs they're taking or other conditions. Essential hypertension just means that it's the main issue is hypertension not caused by another disorder. So really high blood pressure. Symptoms of this can be extreme headaches, epistaxis. What is epistaxis? Nosebleeds. It's one of your med terms for those of you who have taken that class already. Lightheadedness and syncope. Who knows what syncope is? Fainting, good. So some of these symptoms you can make sense. Like if someone's got really high blood pressure, it's like a balloon that's like filled up with too much water, it's about to burst, right? So you can picture that various blood vessels are going to be at risk of rupturing, which is why we get nosebleeds. Some people even get like the bursted eye, the vessels in their eye when they have hypertension. Headaches just because of that pounding and pressure in their head. Why does this happen? Mostly is from lifestyle. So risk factors include things like stress, age. I mean, the older you get, the more at risk you are for hypertension. It can be hereditary. Smoking is Smoking is a big risk factor because the effects of nicotine make the vessels constrict. Okay, and when the vessels are constricted, the pressure goes up. Okay, it's kind of like anybody ever I don't know, anybody like to garden or everybody play with a hose, or you put like your thumb over the hose and it makes the water come out faster. That's basically what hypertension is. It's like you're making the opening of the hose smaller, so you're constricting the opening, which makes it spurt out faster. So you're increasing the pressure of the water. So when your vessels do the same thing, your vessels constrict, it makes your blood pressure higher. Okay, that's why we want vasodilators to open it up and make the pressure go down. Does that make sense? Okay. Obesity and sedentary lifestyle as well. So most of these risk factors are lifestyle related. How do we diagnose this? Well, we're going to look at people's blood pressure. And it's not just a one-time thing, like, oh, you have one blood pressure reading that's high, now you have hypertension. It's like, no, it has to be establish a pattern of having high blood pressure readings. So normal blood pressure is 120 over 80 or below. Okay, so below that is good. Anything, if the top number is over 140 and the bottom number is over 90 over a period of time, right, consistently, that's a diagnosis of hypertension. How do we treat this? Well, there's a bunch of different hypertension meds. Diuretics are a big one. This should be familiar from diabetes insipidus. What an anti-diuretic hormone. What does a diuretic do? It removes fluid. It makes you pee, right? So it gets the fluid out by making you pee. So basically, this like takes away some of the water that's water that's in your system to reduce that pressure. So it's like taking out some of the water out of that water balloon to make it not so pressurized. Okay, so diuretics will help. Then there's different drug classes which will be part of the farm material. But basically there's ACE inhibitors, ARBs, and CCBs, which all bring down blood pressure. Okay, there's just blood pressure medications. All of them work to promote vasodilation. All right, now we've got congestive heart failure. This issue is that the heart is just unable to pump effectively. So essentially the primary purpose of the heart is that it's a pump. Okay, so blood goes in and then the heart has to pump it out to the rest of the body. Okay, so like the heart is a muscle. It has to be strong enough to maintain blood flow to the whole body. Okay, so what happens if the pump gets weak is it starts getting, all the fluid starts getting backed up. Okay, I don't know if anybody here has a septic tank on their house. They grew up maybe having a septic tank. If there's a blockage or the fluid or the liquid isn't flowing along, it can back up and then start going up your toilets, and that's not good, right? That's bad news. So the same kind of thing. If the heart is getting slow or not effective at pumping the blood out of the heart to go to the body, the fluid can kind of sit around and start pooling and make the heart start swelling because it's just, the fluid is just staying in there, okay? It's not getting out appropriately. So the heart is getting congested in a way. You know how when you have a cold or allergies, your nose gets really congested and it's kind of swollen and just kind of fluids just kind of hanging out in there? Same kind of idea with the heart. Those chambers just start to like retain and maintain that fluid. So various symptoms of this. Dyspnea. Anybody know what dyspnea means? Difficulty breathing. Yep, that's correct. And that is because the heart and the lungs are connected, right? Remember I talked about the pulmonary artery, where the blood from the heart gets pumped to the lungs to get oxygen, so that it can pump the oxygen to the rest of the body. Well, if the heart is getting backed up with fluid, that fluid's going to also get backed up into the lungs, which is going to make it difficult to breathe. Okay, tachycardia just means an increased heart rate. Okay, so your heart's going to try and compensate for not being able to pump as well by speeding up. It's like, well, if we can get more beats in, we can get more fluid out. Does that make sense? So it's a compensatory mechanism. It's trying to cope with not being able to pump as well. Increased respirations, jugular vein distension, which I'll show you this picture. This is the jugular vein right there. You can see how it is super swollen and like distended. Okay, so that is a result of the fluid backing up and not being able to be pumped through properly. It's like a big buildup of fluid, so it's backing up into the vessels. Also edema. Anybody know what edema is? Swelling. Yep. So the fluid's going to hang out in those ankles just because it's of gravity, right? So the fluid's going to fall down to the extremities just because the heart isn't pumping everything effectively. So gravity's going to pull that fluid down, keep it in those ankles. What's causing this? Anything that impairs the pumping ability of the heart. So heart attack is a big one. Myocardial infarction, if someone's had previous heart attacks, that means part of their heart muscle is dead, right? It doesn't work anymore. Then maybe there's scar tissue, so obviously the heart isn't going to be at 100% pumping capacity because the cells have died. CAD, coronary artery disease, so the blood flow isn't getting to the heart very well, so the heart's just functioning on less blood and less oxygen, so it's not going to be able to pump as well. Cardiac valve damage. So in between, let's go back to this one picture. In between the different chambers, there are these little like doorways from one to the other. So this is the atria, it pumps through. This is a valve. okay, into the next chamber. The valves are like, you know those water bottles that have the thing you pull up on it and then you can suck on it and you can squeeze it out and you put it back down, and it basically functions the same way. So it allows water to travel one direction. Like water isn't going to go back through the water bottle the other direction. It only comes out. Does that make sense? So the valves work by preventing backflow. So the valves will push the blood into the next chamber while preventing blood from going backwards. Does that make sense? So, but if the valves are malfunctioning, something happens to them or whatever, then there's going to be blood going backwards and forwards and messing up the pump. Does that make sense? Okay, let's go back. Okay, diagnosis. ECG, EKG is the same thing. That's going to look at the electrical waves. I showed you with the waveform with the ST elevation with heart attack. There's also, you can take a picture. Let's see if I have a picture of it. So this is an EKG where they hook you up and look at the electrical signals of the heart. And then an echocardiogram is where they look at kind of like an ultrasound with, anybody ever had a baby, they go in for ultrasound, they can look at the picture of the baby. So like they can look at an image of the heart and watch the blood flowing through the heart. They can watch the valves opening and closing. It's basically like watching, it's like basically a live x-ray in a sense. You can see it moving, and those will kind of help diagnose congestive heart failure. An x-ray can also be useful to show if there's fluid building up anywhere, especially in the lungs. The treatment goal here is to just help the heart to decrease its workload, right? Because the heart is getting overworked right now. The pump isn't working very well, so it needs some help so it doesn't give out. Diuretics are going to be a big one because the pump is messed up, right? And there's fluid backing up. So the best way to help it is to get rid of all that extra fluid. So diuretics will help to limit the amount of fluid that the heart has to pump out. Vasodilators will open up the vessels, help the blood flow better. And then there's digoxin, which is also known as digitalis. This is going to help strengthen the heart, so like make it pump harder. It's going to give it like a little boost so that it's able to squeeze harder and slow it down a little bit. Because remember that one of the symptoms is tachycardia. There's an increased heart rate because the heart's trying to compensate for not being able to pump very hard. So digoxin is going to be helpful to strengthen it and help slow it down. Is anything here confusing? Anything not make sense? Any questions about congestive heart failure? I don't know why this is so small. Okay, sorry about that. Let's see if I can make it bigger. All right, cor pulmonale. This is a heart issue, but it stems from a primary lung issue. Okay, so someone has lung conditions, which eventually leads to heart conditions, if that makes sense. So what happens here is that someone may have, I don't know, lung cancer, or maybe we haven't gotten to the respiratory chapter yet, but it'll make more sense once we get there. But basically someone has basically like increased pressure or fluid in their lungs, in which backs up into the heart, right? Because it goes, the heart and the lungs are connected. So if you have backed up fluid in the heart, it goes to the lungs and vice versa. So this heart issue is because of someone else having lung issues. So the symptoms are going to look very similar as with CHF, the congestive heart failure, because both of these are fluid issues. So the symptoms, again, dyspnea, which is difficulty breathing, the distended neck vein, that popping out, the edema of the extremities, that swelling. So the cause here, the etiology, history of some sort of pulmonary disease. Okay, so increased lung pressure is going to back up into the heart, which causes the heart to stretch out and lose its elasticity. Okay, anybody ever had like a hair tie that just loses its stretchy and now you can't really use it anymore, or maybe like a bathing suit that lost its stretchy? So it's like basically the same idea. Like it gets stretched out and the heart's no longer able to pump effectively. It got stretched out from all the extra fluid. Okay, one of the different signs and symptoms here is that what's going to happen here is that the body is going to create more red blood cells because they're in a state of chronic hypoxia, and this is because of that lung disease. Okay, what's hypoxia? What's hypo? Not enough, right? Not enough oxygen. Right, so hypo, not enough, oxia, oxygen. So whatever lung disorder this person has, whether it be lung cancer or pneumonia or whatever it is, their lungs aren't able to oxygenate the blood very well, because that's the lung's job, right, to put oxygen into the blood. So they're having this chronic state of not enough oxygen because of their lung disease. So the body's going to try and compensate for that by creating more red blood cells. Because what is the job of red blood cells? What's their main purpose? Well, they are the blood, but yes, they carry oxygen. So the red blood cells are the ones that literally deliver the oxygen to the cells. So that's your body's like, we don't have enough oxygen. Let's try and make up for this by creating more oxygen carriers. Does that make sense? So one of the side effects, one of the way to diagnose this is by doing blood studies and looking at their red blood cell count. They're like, wow, your red blood cell count is off the chart, right? And that's your body's way of compensating for the lack of oxygen. Diagnosis, like I said, they'll have some sort of existing pulmonary disease and hypoxia. You can actually measure people's oxygen levels with a little probe. It'll tell you if they're 90% oxygenated, 80% oxygenated, whatever. X-rays can help show fluid. An echo, that's the echocardiogram that I was talking about, where they can use like the ultrasound to look at the images of the heart. They'll see that extra fluid in there. Treatment for this, okay, so we talked about vasodilators, which dilate the blood vessels. There's bronchodilators. What do you think bronchodilators do? You know what bronchus is? Yep, so the bronchus is part of the lung structure. There's bronchus and bronchioles. We haven't gotten to the lung chapters yet, but basically this is going to help open up the lungs, okay? Help get the oxygen flowing, help get the fluid out. It's going to open up the lungs, which is going to fix the hypoxia issue, right? So you'll have more oxygen, which should fix the red blood cell issue, right? So you start with the cause. Open up those lungs, make it easier to breathe, get more oxygen, and then diuretics. Whenever there's a fluid issue, diuretics will help treat that. It'll get rid of the edema as well. Okay, any questions about this one? So it's very similar to CHF, congestive heart failure, except for what's causing it, right? So with congestive heart failure, usually what's causing it is just like someone had, clogged arteries, or they've had a previous heart attack and their heart just doesn't pump that well anymore. With this one, someone has a lung condition which has now affected the heart, okay? Let's see. All right, this is kind of blurry, but it's kind of showing you that how the lungs and the heart is interconnected. So it kind of looks weird, but it shows you that the oxygen in the blood is going from the heart into the lungs and then back into the heart. So it's like if something's wrong with the lungs, it's going to go back into the heart, and if something's wrong with the heart, it's going to go to the lungs. So it's like they're one connected unit, so to speak. All right, pericarditis. Whenever we see the suffix itis, what does that mean? A disease, but like what specifically, what is itis? Inflammation. It's like tonsillitis is inflammation of the tonsils. Bronchitis, inflammation of the bronchi, which is in the lungs. So pericarditis, this is inflammation of the sac surrounding the heart. So remember in neuro, we talked about meningitis, which was inflammation of the membrane surrounding the brain. This is the same idea. It's the inflammation of the membrane surrounding the heart, okay? Symptoms of this, fever. It's caused by some kind of bacterial organism or virus, so you're gonna have a, immune response of some kind. Some chest pain, especially when inhaling or during a heartbeat. So which makes sense, like if you're inhaling, you're putting pressure in that cavity where your heart is, which puts pressure on that sac, or as the heart's beating, like it's messing with the inflamed sac, so it's gonna hurt worse. Dyspnea, pain with breathing. There's also sound of a friction rub. A friction rub, basically someone has a stethoscope and they're listening to what your heart sounds like. It'll sound like this grinding kind of sound, like something is rubbing hard against something else, because the sac is like inflamed and rubbing against the heart muscle in a way that it shouldn't. Usually it's supposed to help lubricate the heart so that it doesn't have that friction, but it's going to sound like two things kind of grinding onto each other when you listen with the stethoscope. What causes this? It's some kind of inflammation infection that started somewhere else in the body, usually viral or bacterial. So let's say someone had like some other infection and it just traveled through the bloodstream and got to the heart. Okay, this inflamed sac makes it harder for the heart to beat as well. Diagnostics, how do we diagnose this? When you do blood tests, they call this a culture and sensitivity, where they can like see if any of the bacteria grows from the blood. That will tell you if there's bacteria in the bloodstream or not. Increased white blood cell count. Why would the white blood cells be increased? Right, because it's an infection, right? So whenever there's an infection, the white blood cells will be higher to fight the infection. And then increased ESR. What does ESR tell us? This is from chapter 3. ESR and CRP, remember those? What do those tell us? Inflammation, right? So this, again, these don't tell us where the inflammation is per se, but it just tells you that there is inflammation somewhere, okay? So it's just a useful tool to kind of to figure out what's maybe going on. And if someone does have an increased ESR or CRP, what medications are going to be useful? Corticosteroids, right? So corticosteroids treat inflammation, and they also calm down autoimmune disorders, right? So those two things. All right, goal here is to reduce the inflammation so that it's not pressing on that heart, causing that heart distress. So corticosteroids are going to be helpful, and then obviously antibiotics if there's a bacterial cause. We won't give antibiotics if it's viral because it won't do anything. Any questions on this one? This is a picture of what the pericardial sac looks like. I don't know why these are so blurry. I'm sorry. They weren't blurry on my computer. I think it's maybe just this computer. All right, now we have myocarditis. So again, another itis. So this is going to be another inflammation. This is inflammation of the heart muscle itself. Okay, so remember myocardium, that's the cells of the heart. So myo is referring to the heart itself. Symptoms here, palpitations. Palpitations are where your heart is kind of like beating irregularly. They kind of beat sporadically. Fatigue, just feeling more tired than usual. Difficulty breathing, dyspnea. Chest tenderness. What causes myocarditis? Is it similar to pericarditis? There's an infection from another source that travels through the bloodstream and lodges into the heart. Everything in the bloodstream eventually goes to the heart, right? Because it has to get pumped to the whole body. So if there's a blood infection, it's most likely going to get to the heart, which is why the heart there's 3 different ways to have it get infected: pericarditis, myocarditis, and then we'll talk about the next one, endocarditis. Okay, so infection from another source. What causes this? Exposure to toxins, for example, street drugs or poison. So those who do IV drugs, IV, I don't know, crack, cocaine, heroin, those sort of things, dirty needles going straight into the bloodstream, right? So it's a direct line access into your bloodstream, which is going to travel straight to that heart. So it's kind of one of those things, or in the hospital, we have to remember that this isn't the only cause, right? So people tend to quickly judge someone, be like, oh, you've got myocarditis, you must be an IV drug user, which be careful not to do that, because sometimes this happens just from someone having like an innocuous like pneumonia or something, and it travels to the heart. Or a lot of people who get dental work done, it will travel from the mouth to the heart. So it's just one of those things to think about. It's not to judge people unnecessarily. Just like people who get lung cancer, they just assume that you were a smoker, when it isn't always true, right? Okay, where are we? Diagnosis. So it's an infection, right? So white blood cells are going to be elevated. ESR is going to be elevated. Increased cardiac enzymes as well. Remember when we talked about the heart attack, myocardial infarction, when the heart is in distress, it's going to release its enzymes, right? So right now, the heart is in distress because it's literally the inflammation of the heart muscle itself. So you'll have the same enzymes released, the troponins that are released during a heart attack. Treatment. If it's a bacterial cause, you can use antibiotics. Rest is going to be helpful to just keep the heart from stressing itself out and overworking it. So this maybe not be the greatest time to like go run a marathon. And then anti-inflammatory meds to help decrease that swelling and inflammation. And this is a picture. This one's not blurry, so that's great. Of what myocarditis looks like. So on the left, it's normal heart tissue. On the right, you can see how swollen the heart tissue itself is. So that's the inflammation of the heart tissue. All right, now we're at the last itis, is endocarditis. So this is inflammation of the very inner lining of the heart, including the valves. So the valves are part of the interior of the heart. So symptoms can be similar: fever because it's an infection, night sweats, weakness, anorexia. Again, this anorexia isn't talking about like the psychological anorexia, bulimia. Anorexia in this context means just lack of desire to eat, not from a mental health perspective, just from not feeling like eating, and fatigue. All right, what causes this? Same thing as the others. They're all three the same as some other infection from somewhere else getting to the bloodstream and getting to the heart. This again is high risk for IV drug users as well. Diagnosis, how do we know if someone has this? We can do an echocardiogram, which is like that ultrasound looking at the picture. What you'll see, actually, really interestingly, is these like little growths on the valves themselves, which is the infection like growing on those valves. So here's a picture of what bacterial endocarditis can look like. They call them vegetative growths because the bacteria just like to cling on to the inside of the valves for whatever reason. I've heard nurses say that it looks like cauliflower on the picture. Treatment. This is going to be treated with aggressive IV antibiotics. You want to put it directly to the source, right? So if you give it IV, it's definitely going to get to the heart, right? Whereas if you take it by mouth, it's going to have to go into the stomach, get digested through the intestines. It's not going to be as strong or as potent if you just give it straight to the bloodstream, and it'll go straight to the heart. Does that make sense? If the valves have been damaged by the bacteria, you might need a possible surgical replacement. They can actually like make synthetic heart valves, which is pretty cool. They can remove the old ones and put in new ones. All right. Any questions about the difference between the three itises, myo, peri, and endocarditis? All right, now we're in rheumatic fever. Rheumatic fever is a systemic inflammatory disease and autoimmune. So it doesn't just affect the heart, but it also affects the joints. It's kind of similar to when we talk about different autoimmune diseases. We talked about lupus and rheumatoid arthritis, where it's like the inflammation of the joints, kind of like the swollen knuckles, the swollen knees. Do you remember that? So the rheumatic part is referring to the joints. So that's where you get rheumatoid arthritis. It's the rheuma is the joints. Okay. So symptoms here, I'll start with etiology first, actually. So what happens here is someone gets strep throat, so a streptococcal infection, and you develop antibodies against the strep bacteria. But for whatever reason, this doesn't happen to everyone, just some people, there's a cross reaction where those antibodies against the strep bacteria start attacking the body, like an autoimmune thing. And no one really knows why, but they start interacting and fighting your own body's tissues. The two places that it goes to is the joints and the heart. So you kind of have like heart issues and joint issues at the same time. This one also has growths developing on the valves, similar to endocarditis like this. So someone might think initially that they have endocarditis and then realize they also have all these joint problems as well and realize that it's rheumatic fever. Okay, so if there's joint involvement, it's not endocarditis, it's rheumatic fever. You diagnose this similarly. White blood cells and ESR are going to be elevated. The cardiac enzymes will also be elevated because that heart is in distress with the antibodies attacking it, right? So if you're attacking yourself, that's not good. Symptoms. So they will have had a history of strep throat recently within the past week or two, fever because they have an infection. Polyarthritis, poly meaning multiple, so it's not going to be just like one joint, it's going to be systemic, like all the joints, so your knees, elbows, hands, whatever. Swelling as well, redness, and limited range of motion. So like it's going to be painful to move those joints, right, because they're going to be swollen and in pain, so you're not going to have as much range of motion. To treat this, you want to treat the cause, right? So it started with a strep infection, so antibiotics to get rid of that strep infection. This isn't on here, but since it is autoimmune, what other drug class can we give? corticosteroids, right? Corticosteroids calms down the immune system when it's having an autoimmune reaction. All right, mitral stenosis. This is hardening of the valves. We talked about the valves a little bit, which prevents them from completely closing. So the names of the valves, you have the left side and the right side. Here on the side of the heart, on the left side, it's called the mitral valve, and on the other side, it's called the tricuspid valve. So mitral valve is talking about the first ones on the left, going from the atria to the ventricle. So what's happening here is that they, for whatever reason, they're getting hardened, kind of like arteriosclerosis. So they're just stiff, so they're not able to really like have the blood go through as well. So symptoms with this is going to be exertional fatigue and dyspnea. So like when you're working hard, not just like at rest, but like when you're running or jogging, it's going to be harder to breathe. You're going to get tired quickly. Some cough and palpitations, just because it's like the valves are like just malfunctioning. They're not pushing everything forward the way that they're supposed to be. What's the cause of this? Rheumatic fever is one of the most common causes, which makes sense because we talked about how what's happening here is that the antibodies are attacking the inside of the heart, right? And it has those growths developing on those valves like this. So those valves can be damaged from this bacteria. And if it gets damaged to the point of not being able to be repaired, that's when you can have the surgery to have a valve replacement, right? Where are we at? Yeah, so rheumatic fever because of those autoantibodies attacking those valves, damaging them. Diagnosis of this, there will be a murmur. So a murmur is kind of like, how do I explain this? So it's normally your heart rate sounds like rhythmic, lub-dub, lub-dub, lub-dub. With a murmur, you kind of hear like extra sound in there. So it's like you might hear a swish or like a hum in the middle of the lub-dub, which is the sound of the blood back flowing through those valves. Does that make sense? So like you can hear lub-dub, shh, lub-dub, shh, lub-dub, shh. And that's like, you can think of like your water bottle squeezing it and the water coming out when it's not supposed to, if that makes sense. A echocardiogram can also see, like live, that those valves are malfunctioning. So you can see how the valves are working with an echocardiogram, seeing it in live action. Treatment for this is, again, going to be to help decrease that workload of the heart. So diuretics will help to give those valves a little bit of a break, and then possible valve replacement if they're just, not going to fix themselves. And here is, again, I'm sorry, I don't know why these are coming out blurry. A normal mitral valve on the left, you can see that they have wide openings, whereas on the right, you can see how it's like much smaller and narrower. We call it mitral valve stenosis. So this is just not able to function as well. All right, we're going to take a break here. Give you guys a chance to kind of decompress. Let's do 10 minutes. So come back at 11:10 and we'll finish up. Okay. Let's see how many do I have left.
she did. It's pretty, I'm on. Take her for a while. Actually, we might go walking, when I pick him up, it kind of depends on the traffic. Up there at the church, okay, let's go walking. If we doing that time, that's when I think we'll be picking up the kids, and today is Tuesday. I think they have the hours up there on the other end on Tuesday and Thursday. If it's a dialysis clinic, oh God.
All right, you guys ready to continue? All right. All right, so arrhythmias. Arrhythmias could also be seen as dysrhythmias, just anything that is not a normal rhythm. Okay, so there's a normal rhythm that your heart does. So any deviation from that is going to be called an arrhythmia or a dysrhythmia. There's a bunch of different ICD-10 codes depending on what this particular dysrhythmia is. In your book, there's a chart with like a bunch of them. You don't need to know those. The ones that you do need to know are just like the basic normal sinus, which is just the normal rhythm, bradycardia, tachycardia, and atrial fibrillation. Those are just the main ones that come up over and over again in the diseases that we talk about. So bradycardia is just a slower than normal heart rate. Tachycardia is a much higher than normal heart rate. And then AFib or atrial fibrillation that's when the heart is just kind of, I don't know how to explain, like it's twitching and fluttering rather than doing a strong pump, right? So normally the heart is like pumps very strongly, but in atrial fibrillation it's kind of trembly and weak, which makes the blood kind of like, you know how like in a river the water is flowing fast, whereas like in a swamp the water is like sitting stagnant and kind of like nasty on the top. It gets stagnant and like growth on it. It's the same kind of thing with the blood. When the heart is pumping, normally and the blood is flowing, the blood stays clean, but when it sits there and kind of gets stagnant, like it starts getting clotty and clumpy, which can throw clots and cause heart attack or stroke, okay? So atrial fibrillation is a huge risk factor, not only for CVA, which we talked about in neuro, but also for MI as well. Does that make sense? Yes, no?
Does it get the growths on the ventricles at all or no?
I'm sorry?
Does it get like the growths on the ventricles like we talked about?
No, there's no growths on it with AFib. It just like the blood itself is getting clumpy, and so like in the veins and the vessels, those clumps can clog like the tinier vessels and prevent the blood from flowing. So a clot that ends up in the brain causes a stroke. A blood clot that ends up in one of the coronary arteries causes a heart attack. And then when we get to the respiratory chapter, a blood clot that goes to the lungs will cause a pulmonary embolism. So all of those things are bad. You need blood to go to your brain, heart, and lungs, right? Okay, so symptoms of arrhythmias. Some of you may have felt like heart palpitations before. Your heart just kind of like starts beating weird, irregular. That often is a symptom of coffee, so maybe not necessarily a heart condition, but just caffeine condition. Heart rate change, just kind of out of the blue, like you'll be sitting still and your heart just starts speeding up or slowing down. Maybe skipping a beat, you feel like it's normally like going like this, and then it just kind of starts skipping. Feeling tired, more tired than usual, even passing out if like your heart rate is so irregular, it's just not pumping the blood where it needs to go, you can pass out. Etiology, so what's causing these arrhythmias? There's a bunch of different things that can cause arrhythmias, so it's kind of one of those things where it's like an intensive workup to see what's going on. But essentially anything that will disturb the electrical conduction system of the heart. And we remember that the SA node and the AV node, there's also the Purkinje fibers as well, but mostly the SA node and the AV node are responsible for the electrical signals that tell the heart like when to beat. It's like, you've seen like in the Frankenstein movie, they shoot electricity and it makes the heart start beating and the monster comes alive. So like basically essentially the same thing. The SA node shoots out electrical impulses which regulate the heart rate. So something's going wrong with that system. The SA node is just firing irregularly. It could also be a side effect of various drugs, but so many different possible causes. So how to diagnose this? I mean, the most obvious one is EKG, which is looking at the electrical activity of the heart, right? So the EKG is going to be all over the place. The thing with an EKG, though, is that it only picks up irregularities if it's happening in that moment. So if you come to the doctor and say, like, hey, I'm having these symptoms of palpitations and skipped beats and whatever, and they do an EKG on you and it comes back normal, that might just mean that you're just not having those symptoms in that particular moment. So what they can do is they can send you home with something called a Holter monitor, which basically is like a portable EKG that you wear like all the time. They even have ones you can wear like in the shower, and it records your electrical activity for like days. So it can like pick up anything that happens when you're not like specifically at the doctor's office. Treatment for this, cardioversion is basically one of the what we call like the shocks. You see like those, like, you know, they take the pads, clear. That's basically like defibrillator, cardioversion, to basically interrupt the messed up electrical signals and kind of restart it. Ablation is when they burn away certain cells that are firing off irregularly. So if that SA node has some like rogue cells that are firing off when they shouldn't be, they can burn those off of the heart and kind of kill them off so that they stop interrupting the flow of the heart. They can also insert a pacemaker. I'm sure several of you maybe have heard of a pacemaker before. It basically takes over the job of the SA node, and it's like an artificial SA node. Here's what a EKG would look like if you have normal heart rate on the top, evenly spaced, not too fast, not too slow. Tachycardia, you can see that there's more wavelengths in a shorter period of time. Each one of those spikes is a heart rate, or a heartbeat, I should say. And then sinus brady on the bottom, you can see that there's less of them, so it's slower. So all of these are like a beat per second, right? So the more beats there are, the faster it is, the less it's slower. And then here, again, it's super blurry, is atrial fibrillation. So on the top is normal, and on the bottom you can see, well, I don't know if you can see it or not, but it's more like, it's kind of wobbly like this instead of clean looking like this. It's got like all these little flutters in the middle. Does that make sense? You kind of see like that's the fluttering and twitching of the heart, not pumping completely. All right, now we're at shock. Shock, you probably heard like from movies or people like, oh, they're going into shock, right? So basically what happens with shock is that it's a complete collapse of the cardiovascular system. So this can be caused from like an extreme emotional response, like, you know, you see, you know, your loved ones die in front of you, and so they start like hyperventilating and panicking, like, oh, they're going into shock, right? It could also happen from an extreme allergic reaction, and you go into anaphylaxis. We talked a little bit about anaphylaxis in the immune chapter in our first unit. A hemorrhage, what's a hemorrhage? Bleeding out, right? So maybe someone like got in a car crash and they're like just losing tons of blood, you can go into shock. So there's lots of different things that can cause it. Basically, it's just your entire cardiovascular system is collapsing in the sense that like your vessels are just like super dilating so that you have like your blood pressure plummets. Okay, so like your heart isn't pumping right, your vessels aren't working right, and so the blood flow is just not going where it needs to go. So it's like your whole body is having a stroke, essentially. So the symptoms of this are going to be extremely pale, cold, clammy skin, very weak. Your heart rate is going to be very rapid, very thin, not very strong. It's going to be like a very faint pulse. Blood pressure is going to drop completely, so it's like it's not going to be hypertension, it's going to be hypotension, so very low blood pressure. Like the blood is not getting to where it needs to go. Diaphoresis. Anybody know what diaphoresis is? Sweating. That's the medical term for sweat. And then feeling of impending doom. That's just kind of like people will say like they just feel like this panic come over them. They feel like they think that they're about to die. It's like that feeling of impending doom. Diagnostics. I mean, you kind of just look at them and you can kind of see how they're reacting. Also looking at their vital signs. So if like their blood pressure is like super low and their heart rate is super weak, and then maybe they pass out and lose consciousness. I mean, it's kind of hard to miss when someone's going into shock. There's not like a blood test that you do. You just kind of look at the symptoms. We talked about causes, and then treatment. So this requires immediate aggressive intervention. If no one intervenes, this can end up in death, right? So like some people are highly allergic to bee stings. You know, they go into anaphylaxis if they don't have an EpiPen with them, they can die, or you know, allergies to anything. Basically, you're going to try and control bleeding if that is one of the causes. So if someone's in hemorrhagic shock, for example, like someone's bleeding out from a wound, controlling the bleeding, maybe giving them a blood transfusion to fix that. Oxygen is good for any kind of shock. Giving IV fluids, just to kind of bring their blood pressure up and get that blood flowing again. All right, emboli. This should be familiar because we talked about this a bunch in CVA. An emboli is a what? Is a clot, right? One is called an embolus. Several is an emboli, like cactus and cacti. Embolus and emboli. An emboli can be made up of various different materials that block a blood vessel. So usually it's, you know, clumped up blood, like a blood clot, like from atrial fibrillation. But it can also be like clumps of fat that break off the vessel walls, like someone who has atherosclerosis and a bunch of plaque. Sometimes those plaque can break off and get lodged in the blood vessels and act like an emboli as well. Clumps of bacteria can actually be an emboli as well. So like, you know, those valves that get covered in those vegetative growths, if one of those breaks free, goes through the bloodstream, it can wedge in a blood vessel and block off the blood vessel as well. Even air bubbles. I know you guys aren't nurses, but this is like one of the things they teach like nursing students is to be really careful, like when you're injecting like, you know, IV fluids or IV drugs, is to not put air into the veins because the air bubbles can also cause clots. It can cause people to have a stroke from an air bubble, so just being really careful not to do that. Most commonly, the most common cause is a clot from the blood, but usually it starts from a leg vein. So usually people who are very inactive or they've just had surgery and they're in bed and they can't exercise, they can't get out of bed, is that they're just laying down and the blood is just kind of staying pooled in their lower extremities. You know, when you exercise, it gets the blood flowing, so it's kind of like the same idea with like the swamp, the dirty swamp water that's just kind of sitting there and getting that nasty film on the top. It's the same idea. Like that's happening with the blood in the legs, the gravity just kind of holding it down there. So that's why one of the things I talk about is like people with bed rest, they're at high risk for clots because they're not moving, they're not getting that blood circulating. You'll know that if you're having what they call it, a deep vein thrombosis, a DVT is what they call that when you have like a clot form in the lower leg. And so you'll have extreme calf pain, it'll start turning red, tender to the touch. How do we treat this? Well, you don't want that clot to end up to the brain or the heart or the lungs, right? If it travels through the body and wedges there, then you'll have a stroke, a heart attack, or a pulmonary embolism. So as long as it's in the leg, it's still like treatable. So to prevent that, you can use, there are two different medications, heparin and Lovenox. These are going to prevent clots from forming. So I don't know if any of you have ever been hospitalized, but a lot of times they'll give you these drugs like in the hospital, especially if you're going to be in bed for a long period of time, to prevent you from getting one of these clots in the first place. Okay, but if you already have a clot, heparin and Lovenox aren't going to break it down. What you'll want to give then is a thrombolytic. A thrombolytic it breaks down current clots. So thrombo meaning thrombus, which is clot, and lytic means to break down. So for prevention, you can do heparin and Lovenox. To treat a current clot, you'll want to give a thrombolytic like TPA, like we talked about with the myocardial infarction, helps break down those clots. Any questions about the emboli? Remember what the difference was from last time, the difference between an emboli and a thrombus? So an emboli is one that's moving, right? And a thrombus is one that's still. So that's why I'm talking about like a DVT, a deep vein thrombosis, is a clot that's wedged somewhere in the leg and not moving. Once it starts moving and going, now it's an emboli. Okay. Okay, so aneurysm. An aneurysm is any weakening of the artery wall. So the blood vessels can get weak from various causes. So some of it can be hereditary. It can be from atherosclerosis, where like all that fat buildup is just weakened the artery wall, or even arteriosclerosis, where they get brittle. Obviously, anything that's hard and brittle is going to be a lot more breakable than something that's like pliable and flexible and bendy. Right, so like breaking a stick is easier than breaking like a spaghetti noodle. Right, so if your vessels are hard and stiff, they're easier to break. Even trauma, so like getting hit really hard can bust an artery. So what happens here is that some symptoms, if you have an aneurysm, you can have extreme pain or throbbing over the site where it's ruptured. You might see like a pulsating mass, so like people who have abdominal aneurysm, so there's like an artery in the abdomen, and when people go in to get like a healthcare checkup, sometimes you can see like a big throbbing on their stomach, and that's like the weakening of that artery there, about to rupture. If it does rupture and they're bleeding out, then they will start having symptoms of shock, right? Except it's just not exterior bleeding, it's just internal bleeding, but either way, you're still bleeding, right? So whether the blood is bleeding outside of your body or inside of your body, you're still losing a lot of blood. Does that make sense? So if it does rupture, you will have symptoms of shock. How to diagnose this? If you're listening to different arteries, you can hear something called a bruit. It looks like bruit, but it's pronounced bruit. It basically is a whistling or swishing sound. Basically, it's turbulence of the blood in that artery swishing around because of how the artery is shaped. So you can see how like the artery is bulging out and it's weak because it maybe got stretched out for whatever reason. So the blood kind of like, instead of it going in a straight line, it gets thrown around, and the turbulence makes that sound, which is called a bruit. You can also do imaging like CT or MRI to see what the artery looks like, and they treat it with surgical repair. So here's a picture of that surgical repair. They put a little wire coil through, and they put like this kind of like internal bandage to keep it from rupturing, if that makes sense. All right, varicose veins. This is not life-threatening like an aneurysm. These are just mostly a cosmetic issue, but also can be painful and annoying. You probably know somebody with varicose veins. These are more common in older women or people that have been on their feet a lot. So a lot of times nurses will have these because they're standing on their feet for 12 hours straight every day. Basically, you'll have swollen and twisted veins in the lower legs. This can make your legs extra tired. You can have like a dull ache. Eventually, as it keeps getting worse, more like leg cramps and swollen ankles. The veins will even be hard to the touch. I'll show you a picture here. On the left is a really bad case of varicose veins. You can see how they're all kind of twisted and like bunched up on each other. The right side isn't as bad, but it's like more of the beginning stages. You can see like the veins are just kind of like ruptured and like kind of like fragile and bleeding. The cause of this, there's, a couple different things that can cause it. Sometimes people are just born with defective or absent valves. So not only does the heart have valves, but your veins also have valves. So the arteries, they pump the blood to the body, right? So they have the force of the heart behind them. Now, when you get blood pumped to your legs, your veins have to pump against gravity to push the blood back up the legs into the heart, right? So that's harder because blood going down is easier because gravity helps you, but like coming back up the body has to go against gravity. So the valves in the veins help to squish the blood up. Okay, so it's kind of like, again, with that water bottle. It squishes it up, and then it goes to the next valve, and it prevents it from backflowing, and it squishes up to the next valve, and that's how it makes its way back up to the heart. If those valves don't work, then the blood isn't going to go back up. It's just going to all fall down and cause the veins to bulge out like this. Does that make sense? Prolonged sitting and standing can also cause this problem. So if you're constantly on your feet and gravity is just pulling all the time, So you know, kicking your legs up, elevation can help that, help drain the blood back out. Diagnosis is really just by looking. You can just be like, yep, I can see you have varicose veins. Some of you might have seen, like, very common in the medical field, people walk around with compression stockings. And like they're these like really tight socks that go up to the knee that help squeeze. It helps kind of put pressure on those veins to help press the fluid out so it doesn't bulge out and cause the veins to stretch out. Also, submerging the legs in warm water can help get that blood flowing, elevating the legs. And then there's also laser surgery that they can do to help fix the veins and make them straighter again. All right, Raynaud's disease. Anybody ever heard of Raynaud's disease? I had a couple students who said that they actually have Raynaud's before. You have it?
Yeah.
Yeah.
Can the varicose veins, can that cause like clots?
I mean, it probably can. Any prolonged sitting or inactivity can cause clots. So this is just what happens to the veins themselves. So it wouldn't be far-fetched to say that like clots can form with this as well. Sorry, what were you saying something too?
No, just that I have Raynaud's.
You do?
Yeah.
What triggers it for you?
Showering?
Really? You do take cold showers?
Not really, no.
Huh, interesting.
But, I mean, I also have erythromyalgia, so I have extreme vasodilation. So that's secondary to it. It's either too much or too little.
Interesting. I haven't heard that one. So with Raynaud's, usually it's in response to cold. That's why I was asking if you take the cold showers. Stress can also be a cause, but typically cold is the main one. What happens here is that it causes the vessels to spasm, so like constricting and dilating kind of like over and over again, like just spasming, kind of having multiple reactions. So when they get exposed to the cold or stress, or I guess in your case, showering, what happens is that the vessels spasm, which is going to restrict the blood flow to the area, causing it to blanch. Blanching means to turn white. So this is a picture of blanching. Okay, so it's like the lack of blood flow to that area. Okay, eventually then it will also turn blue and red as blood flow is restored. Do you have that as well, or do you typically have just the blanching?
No, my fingernails turn blue.
Interesting. Yeah. So causing of this is kind of, no one really knows why some people have it, but what's happening is that the peripheral arteries, so the arteries in your extremities, they spasm, they constrict, which compromises the circulation. Diagnostic is really just looking at, someone's symptoms, be like, yes, you have this. History of paleness and numbness in that area. Usually treatment involves applying warmth to the affected area to kind of get the blood flowing again. What do you do to treat yours, since like the warm water is what causes it?
Yeah, I can't really use like anything too warm because my vasodilation
Mhm.
disorder.
Yeah.
So I go from one to the next.
So,
So there's not too much. You can put lidocaine on it.
does that help?
Interesting. Because it hurts so bad.
Yeah. And when your hands get like really, really cold, and then like you put your hands under like hot water and it hurts so bad. You ever had that? Like that feeling of like the blood flowing rapidly back is actually quite painful. So treatment, usually applying warmth to the affected area will help bring the blood flow back. Stopping smoking, because nicotine is very damaging to the vessels. Avoiding extreme cold, and vasodilators, if you have normal Raynaud's, will help to promote that blood flow. So again, this is what that looks like. That's the blanching. This picture kind of shows a little bit of like, on the far left, you can see that the artery is completely closed so that the fingers turn white, which is the lack of blood flow. And then it starts to flow a little bit back with deoxygenated blood. That's the blue, so that's when your fingers turn blue. And then eventually when it opens back up and allows the blood flow to come back, it turns red. So white, blue, and red. It's very patriotic. Okay. Anemias. Lots of different types of anemias. We're just going to talk about anemia in general, so we don't need to know like all the specific different types that are in the book. Different types of anemias, but basically all of them center around there being a reduction of red blood cells or hemoglobin. Remember that hemoglobin is a building block for red blood cells. Okay, so it's like you can't make a cake without eggs or flour. You can't make red blood cells without hemoglobin. Okay, it's a necessary ingredient. Symptoms of this: fatigue, difficulty breathing, headache, loss of appetite, blah, 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 syncope. So basically a lot of these, not all of them, but a lot of them are related to the fact that you're not getting enough oxygen, right? Because what is the job of red blood cells? To carry oxygen, right? So if you don't have enough carriers, you're not going to get enough oxygen to where you need to go. So you're going to be more tired, right? Fatigue. You're going to have difficulty breathing because you feel like you need to breathe a lot more to try and get more oxygen. Syncope, fainting, it's like because you don't have enough oxygen or blood flow. Pallor is just you're looking pale, so you're kind of whiter and paler than normal. It's from a lack of blood flow. Causes of this: so hemoglobin, like I said, is a building block for red blood cells. Red blood cells' job is to transport oxygen. So reduced red blood cells lead to less oxygen. And then depending on which different type of anemia you have, there's all different types, but don't need to worry about those. How we diagnose anemia is with a blood test. It's called a complete blood count, or a CBC. So this is going to look at the numbers of red blood cells, numbers of white blood cells, blah, 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 blah. So the red blood cells are going to be looked at number, if they're high or low. They're also going to be looked at with size and color. So you can actually look at the blood cells under a microscope. It's called a blood smear, so you can actually see what they look like. You can zoom in real big, make them pop out and be like, oh, these red blood cells are much bigger than they should be, or they're much smaller, or they're much darker, or they're much paler. And those are different types of anemias. Okay, you don't need to know all of that, but that's just how they do it. A lot of deficiencies can cause anemias. So folic acid is one of them. Iron deficiency anemia is probably the most common that you've probably heard of, especially for women who are still of childbearing age and having menstruation, because they lose a lot of blood every month. So iron is related to that. B12 deficiency, this should ring a bell from pernicious anemia, with the autoimmune disease. Pernicious anemia, you didn't have enough B12, right? So that caused pernicious anemia. There's also sickle cell, and sickle cell, I don't know if you guys have heard of sickle cell disease before. You can see in this picture, in the middle, there's a shape of what a normal red blood cell looks like, the round one. And then underneath is a sickle or moon, kind of crescent moon shaped red blood cell. That's sickle cell anemia. Sickle cell anemia tends to be hereditary. It's more common in African Americans. It actually, what's different about this one is that it's extremely painful. So you can see how with normal blood cells, they flow well through the bloodstream, whereas the sickle cell ones, they tend to get tangled up and cause blockages. So this is extremely painful because it basically causes little tiny clots everywhere, and so that pain from ischemia, it hurts really bad. So these patients, when they have what they call a sickle cell crisis, they go to the emergency room, they're in extreme pain, give them pain meds and oxygen, and it helps to clear out the sickle cell. It's not curable, but you can just treat the symptoms. Sickle cell crisis can be triggered by different stressful events. The treatment kind of just depends on what kind of anemia it is. So if it's a deficiency related, you fix the deficiency. So remember, treatment for pernicious anemia was giving B12, but giving it not via the mouth because it can't get absorbed, remember? So depending on what the deficiency is, you fix that. For sickle cell, pain meds and oxygen are the big treatments, and even possibly blood transfusions. If someone has such a low blood volume, and they're have a really, really low red blood cell count, they might need an emergency blood transfusion to make sure they have enough. All right, leukemias. I think we're almost done here too. We have maybe 2 more disorders, or 3 more disorders. So leukemias, what a leukemia is a cancer of the blood cells. Okay, so malignancy is talking about cancer. And I'll show you a picture here. So you can see, like, on the left is what normal blood looks like. On the right is what leukemia looks like. So you see, like, this overgrowth of these cells that shouldn't be there. Okay, so I gave a little caption here. It's blood cancer. You can that's characterized by abnormal proliferation. Proliferation means growth. So abnormal growth of white blood cells, leukocytes. Leukocytes is the medical term for white blood cells, which is why it's called leukemia. Okay, so the term is from the white blood cell. In the bone marrow. The bone marrow is what produces the white blood cells. So these immature and cancerous cells start growing like crazy, and then they crowd out the healthy and normal blood cells, which weakens the immune system, causes anemia, and increases bleeding and other infections because it's taking up space from the other healthy cells to do their jobs. Okay, so symptoms, extreme bone pain, just because the bone marrow is where the cancer is happening, weight loss and fatigue, increased bleeding and bruising, again, because these cancerous cells are hogging up space where, platelets could be. Platelets help to clot, right? So bleeding disorders, swollen lymph nodes because it causes immune problems. There's a bunch of different types of leukemias as well. We're not going to talk about those, just like generally what leukemia is instead of going into each one in depth. Diagnostic is going to be with blood studies. So looking at the number of different cells. There's like a normal range for each type of blood cell. There's like a normal range for red blood cells, a normal range for white blood cells. So you're going to see if these are like higher or lower than normal. You're going to have a lot more immature cells. So they're constantly like growing all of these cells that basically don't function or don't work. So that's why they're cancerous, because they're not able to perform the job that they need to do. You can do a bone marrow biopsy. You've probably heard of a bone marrow transplant before, where people get bone marrow donors from other people to help treat it. Chemotherapy can help. Like I said, bone marrow transplant. So we won't go into all the different varieties of leukemia, but basically it's just cancer of the blood cells. Does that make sense? Any question about this one? All right, last couple slides here. Lymphedema. Lymphedema, well, you know the word edema is swelling, and lymph is referring to like the lymph nodes in the fluid. So what this is an abnormal collection of lymph fluid in the extremities. So symptoms is just going to be super swollen and distended limbs. So it looks like this. Stage 1, barely noticeable, starts getting worse and worse. And stage 4, that's not fat. That is just lymph fluid. So the lymph vessels are clogged for whatever reason, and lymph vessels are just like blood vessels, so they don't carry blood, they carry lymphatic fluid. So there's a blockage somewhere in the lymphatic vessels, and the fluid can't flow. It's just getting stuck and the gravity's pulling it down into the legs. You can do imaging to find out where the obstruction is to treat it. The treatment here, the goal is to reduce the swelling, obviously. So compression bandages can help to press that fluid and get that fluid out. Elevating the legs. Diuretics are going to be the big one as far as medication goes. So that's pretty extreme, as you can see. You can tell if someone has edema because when you press on their extremities, it makes like this big dent. It's like they're pushing on it. It's kind of like poking a water balloon, right? Like it's having all that fluid there is pressing it on there. All right. Hodgkin's lymphoma. This is also a type of cancer. This is cancer of the lymphatic system. So that's why it's lymphoma, okay? Symptoms of this: very enlarged lymph nodes. They're swollen, feeling tired, weight loss. This is caused usually because someone had cancer before. What is it called when cancer starts somewhere else and then travels and goes somewhere to a new location? Metastasis, right? So typically someone had a different type of cancer. It metastasized to the lymphatic system. How they diagnose this is they'll do a lymph node biopsy. So, inserting a needle, pulling out some cells and seeing if they're cancerous or not. What they'll see is something called a Reed-Sternberg cell. Okay, and this is what a Reed-Sternberg cell is. It looks kind of like a cute little alien. But, basically, it is this giant cell that has two nuclei. A nucleus is like the brain of the cell. You guys maybe remember that from anatomy or biology. So in this one cell, there's two nuclei. So like that's the little things look like eyeballs. Usually cells have one. So the Reed-Sternberg cells have two nuclei. And I thought he was kind of cute, so that's why I picked this picture. We treat it with chemotherapy, radiation. Fortunately, this is a very treatable kind of cancer. It's one of the most commonly cured ones, so that is great. There's another one in the book called non-Hodgkin's lymphoma. Don't need to know about that one, but that one is very not treatable. Hodgkin's is, and non-Hodgkin's is not. All right, last one here, I think, is hemophilia. Hemophilia is basically just a bleeding disorder. So people have the inability to clot. So they have unusually prolonged bleeding episodes. They'll have a lot of easy bruising, excessive nosebleeds. Like they bleed more excessively than most people. This is it's more common in men than it is in women, although it is possible for a woman to have it. I don't know if you remember from chapter 1, we talked about like kind of just intro to disease things, and one of the things was X-linked genetic disorders. Remember that the chromosomes, the X and Y chromosomes, what makes a woman? What was it? XX, and a man is XY. So if something is X-linked, that means that the genetic disease is passed through the X chromosome. So if you're a man and you're XY, you only need one of those X's to have the disease, right? Whereas if you're a woman, you'll need both of those X's to have that trait for you to actually have the disease. So it's more common for a man to have it because you only need one X, whereas women need both X's to be genetically mutated. Does that make sense? So it is possible for women to have it, but it's much more common in men. We diagnosed this. There is something called factor 8. It is basically the ability of the platelets to clot. So it's not that they don't have enough platelets. Their platelet numbers come back normal. There's white blood cells, red blood cells, and platelets, and those three things make up the bloodstream. Okay, some people have a reduced platelet count. Okay, that's not what's happening here. They have a normal amount of platelets. It's just that the platelets don't have the ability to clot together. They can't like clump and stay for whatever reason. And that's what the factor 8 does. It allows the platelets to clump together. So how we treat this is that you can give them synthetic factor 8, or you can give them blood transfusions if it's severe enough. But that is it. Yay, we're at the end. Any questions about anything so far? I know it's a lot. This is one of the bigger chapters. That's why I wanted to do it today, to make sure we had time to finish it. We have like 10 minutes left. I'm gonna let you guys maybe just work on the study guides, and then you guys can go for the next just 10 minutes. And if you have any questions about anything, feel free to ask me while I'm here, okay?